so there is some price gouging happening.
Health experts say that profiteers are charging excessive prices for COVID-19 tests. We're going in depth on the loophole allowing this to happen. Plus, great news for people fighting to keep sex offender Douglas Badger out of Rancho Bernardo. The major announcement today by the people who own the home where the state wants to put him. And a touching surprise for the San Diego war veterans heading to Washington, D.C. on their honor flight.
ABC 10 News at 6 starts now.
Accusations of price gouging for COVID-19 tests. Good evening. I'm Steve Atkinson. Kimberly Hunt has the night off tonight. Health experts say that some companies are charging excessive rates, all because of a loophole in the federal law. Our ABC 10 News anchor Derek Stahl is going in depth to explain what's happening.
At a pharmacy, a rapid COVID test costs about $20. But across the country, a company called GS Labs charges $380 for the same thing. And the Kaiser Family Foundation found plenty of other examples.
When we looked at the two major hospitals in each state and DC, we found that COVID-19 diagnostic test prices can range from $20 to $1,400.
So why would anyone pay $1,400 for a COVID test? The short answer is that customers often never see the bill. Their insurance company pays the full amount. And there's a provision in the CARES Act that essentially forces insurers to pay whatever the testing company wants.
There's no standard as to what a reasonable price could be for COVID-19 tests. And so there is some price gouging happening since insurers are required to cover the full cost of COVID tests regardless of what the price is.
Let's back up. Last year, Congress made COVID testing free to patients if it's medically necessary, whether you have insurance or not. Basically, if you think you've been exposed, there's no cost, even if you don't have symptoms or a doctor's referral. Some places might charge you up front, but you can get that reimbursed with a few minor exceptions. And that's where the CARES Act comes in.
In the interest of public health, Congress wanted to make sure that COVID-19 tests were available without any barriers to people. And so they required insurers to cover the full cost of COVID-19 test prices.
Healthcare policy expert Krutika Amin says if private health insurers and testing companies can't negotiate on a price for a COVID test, Section 3202 of the CARES Act forces insurers to pay whatever the testing company lists as their price online. And there's no cap. In lawsuits, insurers say some companies like GS Labs have refused to negotiate, instead posting excessive and objectively unreasonable prices online that insurance has to pay. GS Labs says it's following the law and claims their prices are justified because of their level of customer service. Ultimately, people who get these tests are not paying these high prices now, but some experts and regulators worry they could eventually lead to higher insurance premiums in the future. Derek Stahl, ABC 10 News.
And Congress has taken notice as well. This week, a bipartisan group of lawmakers introduced a bill designed to prevent price gouging for coronavirus tests. Also tonight, California will become the first state in the country to require all school children to be vaccinated. It will take effect once the vaccine gets final FDA approval for the various age groups. Our ABC 10 News reporter Mimi Alcala explains being vaccinated will be a condition of in-person learning.
There's currently a list of immunization requirements for students attending California schools, including vaccines for chickenpox, polio, measles, mumps, and rubella, just to name a few. Friday, Governor Gavin Newsom announced the state will soon be adding one more to that list, a COVID-19 vaccine.
We intend to do that once the FDA has fully approved the vaccine, which will give us time to work with districts, give us time to work with parents.
The requirement could be in effect as early as January 1st or by July. It all depends on full FDA approval for each specific age group.
Concurrent with that phase, we anticipate getting all of our staff following a similar requirement.
Newsom explained there will be two phases with the rollout of this mandate. The first is for students in 7th through 12th grade. The second phase will be for the younger group, kids in kindergarten through 6th grade. Medical, religious, and personal belief exemptions will be allowed. The group Let Them Breathe sent a statement in response saying, in part, families need to be able to make these personal medical decisions themselves, and there is no reason to mandate a vaccine for children who are at low risk from serious complications from the virus. Earlier this week, they threatened legal action against San Diego Unified after the school board voted unanimously to approve a slightly stricter mandate, which allows for medical but not religious or personal belief exemptions. Board President Richard Barrera says he applauds the governor for the statewide mandate, and it doesn't change the district's current plans.
We're very supportive of what the governor announced today. He's setting a baseline, but that districts on their own can set higher standards, and that's what we're doing in San Diego Unified.
Mimi Alcala, ABC 10 News.
And just this afternoon, some healthcare workers protested outside of Rady Children's Hospital against the state's requirement they be vaccinated. The deadline to get their shot, that was yesterday. Rady is giving them 3 options. They can take unpaid leave for 6 months, take a job with less pay that does not involve interacting with patients, or take part in an undefined pandemic separation agreement. We also touch base with other local healthcare systems. UC San Diego Health says about 70 healthcare workers are not vaccinated and are unable to work on site. Scripps Health says 35 employees are not vaccinated and will be terminated. Sharp Healthcare has 305 unvaccinated employees on administrative leave for 30 days. Kaiser has yet to release any numbers. The county announced another 756 COVID cases today, but that was off of more than 38,000 tests. So the test positivity was just 2%. Sadly, the local death toll went up by 3. And you can stay on top of any new developments with coronavirus by downloading the 10 News app. A free version is available in the App Store. It appears the placement of a sexually violent offender, Douglas Badger, in Rancho Bernardo may not happen after all. This afternoon, the people who own that home where the state is proposing Badger lives say they want to back out. They wrote a letter to the judge asking him to rule against placing Badger in their home on Frondosa Drive. The hearing is scheduled for October the 29th. People opposed to Badger's placement can still submit their comments to the sheriff's task force through the 14th. And crews pounced quickly on a brush fire in Oak Park this afternoon. That 1-acre fire broke out a little before 1 o'clock on Choyas Lake Park. No structures were threatened. No one was hurt. Fire crews knocked those flames down from the ground and the air. And temperatures, they were in the 90s as that fire scene erupted right there. Our meteorologist, Angelica Campos, joins us with a look at our latest heat wave. Angelica.
Hi, Steve. Also very dry, which it's really good that our firefighters can just get there and take care of it, because with the conditions we have, relative humidity is very low. Today we had numbers below 10%, and that increases fire danger. The winds are still mostly offshore across the eastern part of the county, and high pressure brought the temperatures up. Right now it's still in the mid-80s in Escondido, but today we had 90s from San Diego into our valleys, foothills, and deserts. Look at the numbers: 91 in Ramona, 91 in Alpine. In San Diego, we reached 90 degrees. And in Borrego, it was only 5 degrees higher than that, with a high of 95 degrees. Other areas that almost made it to the 90s include Chula Vista and Oceanside. We'll have a closer look at the heat that is set to continue this weekend in your 7-day forecast.
Look forward to that, Angelica. Thank you. San Diego Mayor Todd Gloria is back from his trip to Washington, D.C. He met with members of Congress and White House officials. The mayor told our John Horn he hopes the visit pays dividends for San Diego's housing and infrastructure needs.
The mayor's visit to our nation's capital came at a time of uncertainty in San Diego, especially when it comes to housing and jobs. For instance, the city's COVID rental relief program is out of money at a time the state's eviction moratorium expired.
I want them to know that if they do allocate more money for housing and homelessness, that there are cities like San Diego that were prepared to receive those scarce dollars and use them efficiently and effectively.
Gloria said he brought a, quote, good news message to meetings, including with Housing Secretary Marcia Fudge. He pointed to the city doling out more than $100 million to nearly 12,000 qualifying households.
Even after we've expended all these dollars, we anticipate thousands of additional families being on the waiting list for this assistance. If they choose to reprogram those dollars, give them to cities like ours.
The mayor's trip came amid debate over a $1 trillion infrastructure package, and he noted its importance to San Diego's economic and job growth. For instance, Gloria said the $2.1 billion Mid-Coast trolley extension to UC San Diego opening next month was only possible because federal dollars funded 50% of it.
And so the plea for the passage of the infrastructure bill as soon as possible really is a plea to put more San Diegans to work, to get more solutions literally in the ground and on the streets of this city.
Gloria says there is only so much local dollars can do to address issues like traffic congestion and road conditions. John Horn, ABC 10 News.
The mayor arrived back in town just last night. Coming up at 7 o'clock, the other two major issues he addressed in D.C., fully reopening our border crossings and the ongoing concerns over cross-border pollution.